welcome back if you're coming back again after the previous two sessions we have. This is actually a thought leadership series looking at the future of healthcare, and particularly following the COVID-19 crisis. And this series, we're starting to hear some of the stories from around the world of different people engaged in transformation in healthcare. And it's been very exciting so far. We met with Dr. Chung from Hong Kong, looking at big data, Dr. Benjamin, telehealth, and some of the changes within Malaysia. And we're really excited about this next in the series. And I'll do an introduction in just one moment. Just a little bit about the format. This is 45 minutes. We're going to do a short presentation. We are going to request questions and answers. You'll see that there is a question and answers panel that you're able to put in your questions. We'll try and pick some of those out. Unfortunately, we won't get to all of the questions if what happens like last time, but we will try and include those as well. So look forward to this session. I really want to introduce Professor, I'm going to call him Professor Yi because I'm not going to destroy your first name by trying to pronounce it. You can introduce yourself, but Yi Rabella, who has got a CV almost as long as it would take me to get to Brazil today. So engineer by background, but has been working in commercial market intelligence for multiple companies. He is currently chairman of the board of the Brazilian Foundation of Patient Safety, which is really important and very close to our hearts as well. He's professor at the USP School of Medicine with a focus of innovation, entrepreneurship, which we'll hear a little bit more about today as well. I encourage you to go and have a look at his CV online where you registered today. But we're very excited to introduce him today and to give an opportunity to present to us. So I'm going to hand over to him for the next 10 minutes, allow him to introduce his area of subject, tell us a little bit about the change that's happened in Brazil over the last few months, and lead us to where the new normal might be. Thank you.
Thank you, team. It's a pleasure. I would like to thank Elsevier for this invitation, and also to be with all your guests and attendees during this time, and also for asking me to approach this interesting theme that is digital transformation and innovation in times of this pandemic, the COVID. So as you said, I've been playing different roles in the area of healthcare, but always with these eyes from an engineer. So I try to figure out how we fix things and put things in place. So that's how I try to see this topic during the next minutes. Next, please. So I would like to start with this a quote from the renowned Peter Drucker. Of course, that in greater times of turbulence, the danger is to act with the past behavior. So we need to change how we see the future after the pandemic. And this is becoming a very hard thing for us to figure out. How digital transformation will help or not if we don't know how it plays the role in the new digital era, especially after the pandemic. Next, please. Next. So what is the pandemic reality? We are not going to talk here about the disease itself, but how it plays the role under the change during the times on how we treat people. We are seeing different waves, how the pandemic is hitting us. It's like a tsunami. We are seeing the big hit now with the first wave of disease patients that is loading our ICUs. But what concerns me more is the waves that comes after, because they have a long tail and a long time. And that's where I believe the digital transformation and innovation will play a serious role and probably will help us to cope with this pandemic footprint. Next. So we are seeing more of these so-called new normal after the pandemic. I prefer to say that we should visualize a new reality, because normal is different from every person, every country, every situation. But a new reality is we need to cope now with the pandemic and post-pandemic. Next. So what the future will bring to us in digital transformation? First, the future will be faster. So future is not too far away. It's just after tomorrow. And to do that, innovation needs to be more flexible and more convergence than it used to be before. We need to do things faster. And we are seeing this on this pandemic, right? We are seeing a lot of efforts through new vaccines, new drugs, new devices for hospitals. So everything has been expedited. So innovation in digital transformation has been pushed to the envelope, to the edge. Next. And one thing that is a new kid on the block, per se, is the consumer expectations, because the digital transformation in the healthcare is being fed by the consumers from their experience in other areas, like on the on-demand service, like on new products that they are using, their wearables. So personalization is coming from other consumer areas to the healthcare. And this will impact on how we will transform many of the devices, service, and probably the business model in healthcare. And digital transformation plays a major role in that part. How we do new technologies, how we reinvent older technologies. That's our questions that we need to face now. Next. And I like very much this diagram. This is a study from 3 years ago. And digital transformation and innovation in healthcare is more of three pillars, okay? Digital health are the tools that we are envisioning, that we are creating. 3D printing, wearables, telemedicine, mobile, virtual reality, all this stuff are tools. But the data is what the history tells us about the people, okay? So we need to mix the tools with the data, is what with why, but to whom is the precision medicine, is how we combine. So these roads, this mix are the ones that will tell us how digital transformation will be delivered to every single person, or a combination group of persons that will benefit from these devices, the information they generate, plus to whom we are providing this service. So that will be key on innovating and transforming. Next. Next. And this is easy. Please, one back. And this is how we are seeing every person now. The super convergence of the digital media is creating an individual footprint. Everybody has their own footprint. And this will help us to go from the disease management, that is the current status that we have on healthcare, to the prevention that is better, cheaper, and more effective. Okay, but the way we are going to use this path, this journey from disease, diagnostics, better management, improved prediction with the new IT and artificial intelligence and machine learnings to have a better model of prevention. This is how we are going to evolve, how this is going to play a role. And that's something that we need to figure out. And this is not easy. This is tricky, because we need to have good data and good understanding to whom we are providing the service. Are the people a combination of groups, for example, hypertension people, or a combination of service providers. So a group of hospitals or clinics, we need to model that. And that's probably the way we need to redesign our healthcare service. Next, please. And that's the environment where the digital transformation will have its phase. It's the medical technology around mobile. So the personalization comes to the individual on their smartphones or their devices they use. It's something that provides them direct contact with the service providers or online consultation. It changes the perception that it's not disease management, but it's healthy lifestyle management. So we are providing a positive approach. It's a healthy approach. And the pocket doctor is the point of care. So we are bringing the care closer to the user. And this plays a major role specific after the pandemic, when most of the people were in quarantine, isolated, and they could not get to the hospital care. So how we do the reverse, we de-hospitalize the technology so it can go to where the patient is. So this is going to be a change on the model too. Next. And this will make us create the new blockbuster drug, is patient engagement. So patient engagement is key. It's not only to adherence to the drug medication, but to their own care, to their care planning. So this is tough to do. It's not easy, but we need to feed from other markets where the consumer engagement makes a lot difference. So this is going to be important. Next. And why? Because the people is changing, has changed. The people perception now, like this picture shows, that the patient is not more a passive person. He is part of the journey. He wants to be part of the history. So not only on this, you see people getting a picture of themselves in a moment of the history. This was the last campaign in US, but now that's the same thing that is happening in healthcare. People are looking to them as part of the game. So we need to change also our point of perspective on introducing the new technology. Next. And this brings us half a century back. So 50 years ago, on this British journal, it was an interesting article saying that the possibility of patient-centered medicine was a huge horizon, okay? But to do it, we needed to understand the patient as a whole. And this is not easy. 50 years ago was very tough, but now we have the tools to do it. And digital transformation, innovation will take us there. But we need to change our behavior and our perspective towards the patient. So we need to do this so we do not come back to this article 50 years later. That's the point. Next. And to conclude my part, I liked the position from Steve Jobs saying how we are going to fight the COVID and any pandemic from now on with digital transformation and innovation. Simple thing, think different. We need to think different because as we started saying from Peter Drucker, if we think like we did before, we will not be able to cope with these new challenges that we are facing right now. And the pandemic is bad itself, but we can learn from what is telling us on the opportunities we have ahead. Thank you.
Wonderful, Guy. Thank you very much. And can I just remind everybody, please do start dropping your questions or continue to drop your questions into the question and answer, and then we'll start to pick some of those out. That's fascinating. And I think, you know, in the terms of the background of where Brazil is currently within the COVID crisis, clearly it is a very tough time within Brazil at the moment. And a lot of the people you'll be working with, of course, are facing the front line and looking after patients. I think one of the really interesting parts of your presentation was the slide which looked at the different stages that we're at, or the different waves that we might be at. And I think the one thing that strikes me is when you look at wave 4, which really is our healthcare providers, the psychiatric trauma that maybe people would experience at that time, the mental illness and the economic injury, not just to to the globe, but also people on the ground who are experiencing loss of work and things. Do you see technology and innovation starting to support those as well within the future?
Sure, that's an excellent point. The burnout, the psychological impact, and so on is something that the technology can cope. We have, for example, the telepsychology. So many people are being treated and being reached through telemedicine. So this is something that we can help. Some applications, some apps are helping to do a triage on stress base, so people can evaluate, they can see how well they are or how bad they are. And the economics means that if we do digital transformation and innovation in a quiet way, we can develop new economic models for healthcare that can generate new revenues for companies and new employees. So I see this as an opportunity. It's not easy. It's not easy, but I think that's an opportunity that should be pursued.
Yeah, and of course the third wave, even before that, of course, is that during this pandemic, we've actually missed out on seeing patients who might be in the early diagnosis of cancer. They might be in chronic health conditions which they're trying to manage as well. Presumably, you expect innovation to start to really remove some of the barriers to allow people to be managed as well within those groups, do you?
Yes. At my hospital, there is a heart center in São Paulo. We are a tertiary hospital, so we have many chronic patients. And we are seeing news that a lot of these chronic patients are not going to the hospitals or to the clinics to do their follow-ups. They are afraid to go to get the disease or something. So I believe these chronic patients that have a long tail, they need to be considered as potential patients for telecare. Okay, so the business model of the telecommunication, the telemedicine, to cope with distance patients and monitoring them and doing point of care measurements and so on, will play a major role to reduce the stress and reduce the impact on the chronic patient unmanaged. So this is something that we look forward, and this is a massive amount of people around the world, the chronic patients. Yeah. So this is something that we need to learn to do well.
And in terms of Brazil, were there any changes in legislation or in healthcare that allowed some of these new normals to take place? We've heard from other countries, they didn't have the infrastructure. And in fact, telehealth wasn't allowed at that time. Did you have to change anything, or has anything changed in Brazil to make that possible?
Sure, yes. For example, the telemedicine was not regulated well in Brazil until recently, but with the pandemic, we had passed a legislation to allow us to do an improved telemedicine service. I believe that this will stay for good. Also, we are allowing to do better data collection that we didn't have before. As you know, many countries still have their silos of data. So we had to share more data on that. So I believe this will be a key. And it's complex with all the privacy issues, right? So we have to share data, but now we are needing to be better in keeping the data safe. So this is something that I believe everywhere is going to face. So some of the things that we are doing now, we only are doing because recently they allow us to do because of the pandemic. And I hope that this is a learning curve that will stay. We need to understand that these are opportunities for us to learn well and later on play this on a better mode.
Yeah, and presumably the numbers which are still going up in terms of the people, some of this technology in terms of telehealth, in terms of being able to assess yourself to remain at home and self-isolate, new technology is being made available to everybody in Brazil as they are in other countries as well?
Not quite well. We have a very different demographic as many big countries. So the top of the pyramid has access. Usually the richer people has. The poorer people doesn't. As a country that has social health care available, some of the access we provide to this new technology are provided to everyone, but we don't have enough equipment or solutions to everybody. So we need to do an analysis on who has the best benefit of which devices and which solutions, okay? So this is something that will be evaluated everywhere. What's the best mix for the patient? And we need to see a better access. And I think the economic part plays a big role. Still, it's very expensive to some part of the population to get access to these new tools. We hope that with the expansion, they will get cheaper.
Yeah, yeah. And I think that brings to a very interesting point about the management of patients. When you look at patient engagement, as you say, that is really something you could add value to healthcare. But often when you look at health and well-being, it is the top tier in society who have immediate access to that. And you look at actually, people often only get engaged in healthcare when they become unwell or when they become impacted. So how do you perceive in the new normal that you're going to engage with those who are perhaps economically not thinking of their health at the earliest stage?
Wow, Tim, that's the $5 million question, right? How we will engage the patients. I would say that we are in the transformation phase of changing health from disease management. That it was something the people had in mind. So I will engage if I am not healthy, to a newer point where I need to keep engaged to be healthy, to keep my health. So it's a paradigm shift, okay? And how we do this? First, education. Second, benefits. It's like us when we fly from the same airline. Why you engage on their plan to be always flying with the same? Is because you have benefits, okay? You have a better experience, you like. So I believe the new value model, the value healthcare model, will give them incentive to be healthy. And this plays a role on cost reduction for them, but also on the benefits they have to be living longer with better quality. So it's education, communication, and a better care planning to deliver. It's something that we need to build, but I believe that's something that is worth the effort.
And I mean, in fact, this has come up on one of the questions. John Ray Dormentas has actually asking really where countries who can't necessarily buy into this, the new normal, because of availability, cost, constraints, etc. So how do you see innovation in this way as being low cost in terms of implementation? Or does there have to be upfront investment? How would you start that in countries who perhaps don't have the same resources?
Well, John, excellent question. Thanks. I believe that innovation plays a much bigger role in countries that have less resources, because innovation is not adding cost, is not adding nice gadgets. It's not adding just a new tomography that has a higher resolution. That's not what innovation means, okay? Innovation means that we need to have a good idea on a problem. We can materialize this on a new product or a new process and create value. And value means not cost or price. Value is what we return. So sometimes the population is poorer, but then it's a play for the government. So they need to make the innovation investment because they have a massive benefit for delivering new stuff to the population. So it will change from country to country, but innovation means more to the people that has less to buy. And that's the best innovation impact we can give, is for the ones that cannot afford, but will benefit more.
Excellent. One of the areas that you've been talking about, of course, is big data and this massive information that we're gathering. We talk about small data because we're actually gathering data on ourselves. I have white coat syndrome when it comes to blood pressure. Every time I go to my GP, the blood pressure goes up. I take my blood pressure regularly at home, absolutely normal. Do you think physicians are prepared to look at patient data and use that to evaluate patients now in terms of innovation? Or do you think that they still are suspicious of some of the devices out there capturing data?
That's a good point. I would say that physicians will need to be convinced that small and big data plays a major role for them, as the clinical trials does for them to be trusting on a drug, okay? It's just a compliance of how good you manage the data, how reliable they are when you capture. So it's not any device, so is the device reliable? If it is, the data should be trusted. But are they prepared to consume the data? No, they are not. So that's where I believe we should go with artificial intelligence, all these algorithms that will help them translate the data into diagnostics and orientation. Okay, because that's their language. They need to understand what it means so I can take an action to take care of my patient. So that's where transformation and innovation of these tools will translate to the doctors the data into actions.
Excellent, thank you. Now we're going to just take a very short poll break at the moment. In a second, there's going to be a poll that's going to appear on your screen. We're asking questions about the impact of healthcare where you are and what you're seeing. And today what we're interested in is what are the forces that are affecting innovations in healthcare? And we've got some areas that we're wondering where you think the interest lies. But just to remind you, we are receiving plenty of questions on the question and answers board. Please do keep firing those in. I will pick some out as we continue the conversation. But if we could go to the poll now, that'd be great. And we'll just spend a minute or so capturing your information from the number of people here. It hasn't appeared on my screen yet. Yeah, there we go. Thank you. So what are the forces that are